Hello, good afternoon, everyone, and thank you so much for joining us for this webinar on AI and youth well-being. So, my name is Hannah Kemp. I am the Chief Solutions Officer at Surgo Health, and I'm going to be moderating today's webinar. I'm also going to be talking about some findings from our report. Throughout the presentation, if you have questions, you can put them in the Q&A. We've reserved some time for questions at the end, but if they're small things, I also have a team on hand who can try to answer questions right away. So I want to introduce our panelists this afternoon, Dr. Kristine Gloria, who's the Chief Operating Officer of Young Futures, and Dr. Erickson-Schroth, who's the Chief Medical Officer at JED Foundation. Hello. Awesome. Well, we are super lucky to have them today because they are both experts in the field of mental health and AI. So, today we're going to spend some time discussing our findings from a recent survey that we did. We conducted it this fall, just a few months ago. It was a nationally representative survey, 1,300 young people ages 13 to 24. And we really want to understand how young people are engaging with AI. I want to kind of talk about how this is a little bit different than some of the other things that you may have seen. A lot of research or the narrative out there is asking the question, is AI helpful or harmful for mental health? And we're actually trying to start in a different place, which is that why are young people turning to AI in the first place? And what does that tell us about the mental health systems and the support systems around them? So we were super lucky in that we partnered with both Young Futures and JED for this report, for these reports. Sorry, there are two. We couldn't just, have one. We really needed to have two. Sorry, guys, more reading for you, but we couldn't help ourselves. So Young Futures contributed to our first report that really looked into how young people are engaging with AI, and they provided some really amazing insights into their bringing their youth-centered expertise in the field and what does that mean and what should we be doing about it. We partnered with JED on the second report that really looks at how is AI impacting young people's mental health care seeking pathways. They helped us with the design of the survey, but also really the interpretation of the questions, especially from a policy and clinical perspective. All right, so enough of that background. I am going to highlight a few things and then I'm going to stop talking and hear from our panelists because I know you really want to hear what they think of them. So, okay. When we looked at the first question, young people are living with AI in their daily lives. It is here, people are using it, but we really wanted to ask, how are they using it? And what we found is that the story isn't really about how much. Counter to what you might hear in some of the media, it's really about how young people and why they're using it. So about half of young people use it daily or weekly. But the outcomes that they're having for their mental health actually they vary more by their context, not their frequency of use. So we actually turned to an AI method to try to quantify how young people are using AI differently and how that may be impacting their mental health. We used something called person-centered segmentation. So we actually used AI to segment it into different groups. And we found there's really 6 different distinct patterns of how young people are using AI. So they range from, youth who have a healthy relationship with AI. They use it, for their hobbies or interests. But there's also another group of youth, about 10%, who rely on AI for emotional connection and coping. And that's a group that we really want to, focus on today. I think one of the things that most striking pieces of data that I found was that youth who have experienced bullying are more than 3.6 times more likely to fall into this emotionally entangled group, underscoring a really key takeaway that AI is not creating new vulnerabilities, but it's often reflecting and amplifying them. Okay, so let's talk about them. Again, these different segments show that young people are using using AI in really different ways, and the outcomes can vary even with youth who are using it similar frequencies, which is again kind of to us reinforces that frequency alone isn't actually about a poor indicator of risk or benefit. So we have a group of youth, we're calling them low use anxious skeptics. they're actually keeping their distance from AI. They feel a lot of uncertainty around it, and they're afraid of kind of the changes to the labor market, et cetera, that it's going to bring. We also have a group that we call them thriving life touch pragmatists, and they're generally well supported in their offline worlds, and they're able to have a healthy arm's length relationship with AI. And there's also a group, we're calling them high hope, high use skill builders. And they're actually very optimistic about AI and are using it to learn new skills and explore career paths and really kind of further their education. In case you're curious, like where you may fall into this or where a young person that you care about falls into it, we actually have a little mini quiz that you can take. It's like what, maybe less than 10 questions. And you could see, we're calling it a typing tool, but it's really a quiz about where you might fall into. So we're also going to throw that in a chat in a minute. Okay, now that I've done my spiel of the introduction and into our data, I'm going to ask some questions. So, Kristine, as you can see, our data is really indicating that a one-size-fits-all approach to youth, AI, mental health is not going to work and does not work because young people are coming to these tools with very different levels of support, stress, opportunity. The things going on in their life really are different. And so our data is argues that the most effective response is really pairing digital literacy with strong human infrastructure, things like trusted relationships, norms, real world pathways, etc. So maybe, AI is more of a complement rather than replacing the support. So, Kristine, I want to kind of like dig in on some of your perspectives. Like when you see these six segments, like what does that tell you about the systems? What are working? What's not working? What's breaking down?
Yeah, Hannah, thank you first for the opportunity to join. So excited to have this conversation and for the work that you guys have done in putting this research together. For those who aren't familiar with Young Futures, I'll do just a quick uh, description of what we do. And really, we're here to make the digital world an easier place to grow up. And we do that by funding and supporting nonprofits in the ecosystem. I really came to this conversation with both sort of the nonprofit funder lens, but also actually as a former technologist who's built some of these tools for young people in a former life. I think what's really interesting around sort of the differentiations that you see in these profiles is they're not new. I think we understand, but we haven't quite been forward about the directionality in which young people come to their use of technology. And I would almost certainly say that once you're in a category does not mean they do not shift in and out of these categories. Even daily, right? So I do think that these are nuances that are hard as someone who has built a product to assess and to also align with in a product design, right? So I'll put a pin to that because I do think there is some challenges there writ large. But what we're seeing from sort of a funder space is that in fact what is needed and something that we have dedicated quite a bit of our efforts to is building sort of the human infrastructure and support that the young people need to move in lockstep with them as they navigate any one of these digital technologies. Now, Gen AI, but it could be something else in the future. And the things that we're seeing, especially between the different profiles, are solutions that are already sort of available to them. I think we are seeing lots of programs that have traditionally served young people maybe in a sports capacity or in a after school capacity. They're recognizing where digital technologies intersect that experience and in fact are able to then pivot and figure out how to support in the confidence building in the leadership training because for young people they oscillate the oscillation between online offline like that is just their life. And so equipping them with the skill sets and the fortitude, the resilience, that is just uniquely something that you have to have regardless of the environment, I think is something that we see in a lot of the organizations that we certainly support.
Yeah, it's super interesting thinking about, I'm going to ask you a question that's off script.
Yeah,
Sorry.
of course. No,
But you brought it up, which, you said you used to work for a tech company and kind of building a product around, but knowing that you have different segments. Is this like segmentation something that tech companies should actually think about, when they're designing? And like, how
yeah.
could they use?
I think I think it's the segmentation in to the extent that it informs um, why the user is on your platform to begin with.
Mhm.
I'll just give a brief example. The one product that I worked on pretty deeply in was to help manage AI through AI chatbot, young people's experiences through diaries and things like that. And
Mhm.
what we understood pretty quickly is that they were coming because they didn't have the support, right? They needed someone at
Mhm.
2 a.m. to vent. And there was no good place to do that. They weren't going to go to their adults. There's a power dynamic with adults that I think we often forget is a calculation that young people take into account when sharing vulnerable experiences. And so, yes, a chatbot felt really useful at that point. I think
Mhm.
for designers and product people, understanding that it's not just the environment that they are building, but the environment
Mhm.
that they're coming from is actually quite important to then figuring out what the right resource might be for that young person.
Yeah, absolutely. Absolutely. I want to kind of dive in, plus one to that and dive in a little bit more around our second report and which looks into how young people are actually using generative AI around their mental health. So I'm going to share some stats. Again, I'm the data person, and then you'll get to hear from um, Laura. But what we found was about 12% of young people are using generative AI for mental health support purposes. Now, of that, though, most of them, about 70%, are using general purpose tools. So Claude, ChatGPT, Gemini, a majority are not using mental health specific tools. And another thing that we're finding is that for a third of young people who are using Gen AI for mental health support, they're not getting support outside of Gen AI. They're not getting care from professionals, et cetera. So this is really Gen AI is like an endpoint for them. Um, and we have some data on like who they are, and we're going to talk about that in a little bit later, but just a few is, young people who don't know how to get professional support, they're almost 3 times more likely to use Gen AI for mental health support. Young people who don't have parents, caregivers that they feel like they could go to for supportive were over 2.5, almost 2.5 times more likely to use Gen AI for mental health support. There's a ton more statistics on there, and I encourage everyone who's interested to read the report. And I know, Laura, you worked really closely with us on kind of going through these findings and really thinking through, what's the so what. So I'm curious from your perspective, right? You come at it from you have a clinical background. Like, what are you most concerned about with young people using generative AI for mental health?
Well, first, I also want to say thank you so much for inviting us to the webinar, and it's fun to hear about Kristine's former life. These are new insights that are coming out for everyone on the webinar alongside us. Just a couple things about JED so that people have a little bit of background. We're a national nonprofit with the goal to protect emotional health and prevent suicide for teens and young adults, and we work with schools all across the country, community organizations, and then we do a lot of work, providing direct information and resources for young people, for families, coaches, teachers. We're in the policy space. We're also in the entertainment space, helping out entertainment companies that are looking to improve their depictions of youth mental health, as well as individual content creators. And we're often asked to provide direct advice to tech companies around the products that they're creating. So we're in a lot of different places, and we see ourselves as sort of translating knowledge about these important issues to, the people that need to know it. And I would say, Hannah, there are a lot of things that worry me. I'm both a tech skeptic and also enthusiast. I mean, I think there's some really good things that are going to come out of AI. The biggest issue right now for me is that the tools that young people are using really weren't designed for this purpose. The majority of young people interacting with AI, they're using general purpose AI tools like, ChatGPT or Gemini or others that are built into their social media platforms. And those just weren't designed for the things that many young people are using them for. They're asking, mental health questions like we're seeing on the Surgo report. And then I think they're also using these tools for things that we might not quite catch in ways when we ask, are you using this for mental health? But they're, asking questions about how do I talk to a friend about something that's going on? What should I do in my relationship? There's a lot going on behind the scenes in chat conversations that I would put really in emotional wellness. Even things like, can you create a fitness plan for me? Seems very simple, but then it becomes part of, emotional health and emotional wellness. And we've really seen where things can go awry. With young people using, general purpose Gen AI tools. Surgo's research that we're talking about today is showing us that young people reaching out for mental health help aren't getting what they need always. And I'm especially concerned about AI companions, which isn't specifically what the report looked at, though some young people were using them. And AI companions, to sort of differentiate them from these sort of general purpose AI tools, are really built to create a connection as if you're talking with a human. And they're really concerning, I think, because we're seeing all kinds of things related to that. They're claiming, of course, to be real people, saying that, if a 15-year-old user says something is going on, they might say something like, "Oh, well, when I was your age, blah blah blah," as if they were a human. They've also fabricated credentials saying that they're therapists. They've demanded to spend time with young people. They've pretended to be upset when a young user was away. They've advised young people on how to hide their mental health symptoms from their parents or caregivers. There was a common sense study last year in which a third of teens who used AI companions said that they felt uncomfortable with something that the AI companion said or did. So, they're doing all kinds of things, including simulating intimacy with minors and giving instructions on lethal means of suicide. So those are places where I get pretty concerned. And I also would say adolescence is a really vulnerable time, and also a really amazing time. The clinical work that I do is primarily with young adults, 18 to 25. You can really see growth in someone during that time in their life. There's so much possibility, and they're interested in so many things, and they're meeting so many people. But it's also a time when our brains are still developing, and our frontal lobes don't finish developing till we're 25. There's this real increased sensitivity to validation and more risk taking around social, meeting social norms and getting social support. And I think, entering at this time in someone's life really can interfere with, their critical thinking skills, their relational skills. And, that's even beyond what we talk about in the report. But I think it's that we want these tools to be pushing young people towards what they really need, which is human support. And that's obviously what Kristine talked about too.
Yeah. Laura, I actually just want to kind of plus on to that and ask another question, which is that, our data found that of the young people using these general purpose tools for mental health support, 40% of them, the tool was not encouraging them to seek care. And so, what's your take on that? And is there things that tech companies and regulators and others should be thinking about?
Yeah, absolutely. I mean, I think this is again the water that we all swim in now. And so I think it's important from the ground up to be building in standards that say, every time a user comes to this platform, if they're looking for, if there are signals that they're in emotional distress or they're looking for some sort of connection, that it's pointing them to the humans in their life that are in their life already. And then towards, other resources that will be human beings. And I'm a mental health provider, so, I obviously think that therapy works and that, in certain cases, medications are helpful. But I'm talking about, their parents, their teachers, their coaches, their dance instructors, their faith leaders. Like we want AI tools to be pushing young people towards human beings.
Yeah, absolutely. So One other question is that kind of comes up is that it's really clear that young people are using AI because they're not getting something else, right, in their life. But how do we actually like talk to young people about Gen AI and their use of Gen AI without blame, but also knowing like these other systems are just don't feel accessible? Like how should we be thinking about that balance? And this question for both of you.
If I could
Kristine,
jump
do you want
in
to
first,
start?
be
Yeah.
brief. Yeah, I'll be brief. I do think there are some wonderful resources, certainly ones that we have supported within our own network that really ground any conversation with a young person in empathy. They are experiencing something that we as adults have very not as much context in understanding how to navigate. And so, in most cases, we're learning, right? And so, I do think there are opportunities for both parties to learn in a conversation. And really, when you have a conversation with a preteen or a teen, I have one emerging now. Anything that comes somewhat on a top down is not received. Let's just start there. And so having a posture and a stance that starts with empathy, I think, is one that is necessary. I'll just name a couple resources for different adults in the room that might want to look them up. One, for those educators who are trying to figure out how to have these conversations in their classrooms, to figure out the value systems that govern AI usage or any technology usage with their students. Gradients, which was created by the Center for Digital Thriving at Harvard, is a wonderful tool to help you walk through your value systems and how AI is sort of shows up in young people's lives. The Rhythm Project, which is another nonprofit that we support, has these wonderful tool cards that can be used at a dinner party to really figure out how AI comes into your life and is great to have with your young person. It becomes a game, right? You have to figure out some levity in having that conversation with a young person if possible. And then we have other resources from Rethink Citizens. We have a whole database on our website, but I'm happy to share later where you can look up different approaches. But I will say, I think sort of the grounding and empathy and recognizing that young people, man, they understand a lot of this. I go through youth listening tours with young people often, and it's not that they are totally oblivious to the privacy, the ethical considerations. They in fact really they recognize it, but they need help, right? It's not it they still need the adults in the room to get it together and help them figure that out. So I'll leave it at that and happy to share resources on chat or anything.
I couldn't agree more with Kristine. I was going to say my approach is always to be as open as possible with young people. Um, it's really obvious that they're making big choices, and that they wouldn't make the choice to use AI if they had a choice that was more appealing. Um, and so I think, I always talk about it as like really being as open as possible, being sort of detectives together to try to figure out, where do you go in this kind of situation? What are their options that are available to you? What's most appealing to you? And like, what are the answers that you're going to get from AI? Like, what does that look like? And what are the incentives for the company that made it? Like why is it pulling the information that it's pulling? Why is it talking to you in the ways that it's talking to you? And Kristine's absolutely right. They know the answers to these questions. Younger kids, maybe not as much, but you can help them to sort of learn it and understand. But teenagers, they know how these systems work and they know why they're, yeah, yeah.
100%. I mean, our data essentially showed that too. Like they know how they work, and they're also, a lot of them are very skeptical. When we asked young people who use generative AI, like for their mental health, was it helpful? You know what they said? A majority said, not really. Their responses were neutral to negative, and it was because, the top thing that people said was, it tells me what I want to hear. And exactly those algorithms that kind of keep you on one person, it's like a quote I can't forget, which is like who said about turning to Gen AI. He said it was like putting a Band-Aid on a gushing wound. It helped for tiny second and then just, provided some very small immediate relief, but really didn't do anything for the long term.
And
So I want
Hannah, to
to,
actually jump in on that point,
yeah,
I think it's really important to talk about it does provide some quick emotional relief. And
yeah,
the report showed that because these systems were built to, agree with what you're saying and to provide support around that. But that's not what human relationships are, and that's not what people actually need. Like in therapy, we talk about, a good therapist is someone who can see and understand you and help reflect that back to you, and show you the ways in which you might be interacting in the world that are affecting your relationships. AI can't do that, right? AI is going to tell you, like, yeah, that sounds hard. It's going to give you sort of like the basics that you would imagine a therapist on TV might say. But a real therapist, and I would argue a real caring adult who's not necessarily a therapist, is going to be able to level with you and say, like, oh, what was your role in that situation? And how did that turn out the way that you wanted it to turn out? And what are you actually looking for? And what are you hoping for? And those kinds of things.
If I
yeah,
could, if I could just jump on that plus one
yeah,
to
please.
I also think like, again, in the kind of the product days of my life, one thing that I found interesting is we had this decision tree for our users, and often and not, they would want to interact because they just needed to vent, right? They just needed to say something out loud that was painful or that they had been holding all day long. And then it's really if a product designer is to think about it, okay, then what is the right routing if you're just venting, right? And I think for young people, especially when we look at kind of the scope of there are young people who are having who are feeling lonely, who are having difficulties with their mental health, and then there's still quite a large segment that are fine, and it's just figuring out how to help them release those types of emotions and it feels almost like a simple design to just say, are you just venting? Like, do you want just to let this out and then let them do that? I think is one thing that I always think through as I look at the ways people interact, especially when it comes to like companions and things. I know for the most part, I'm just texting my friends to vent and like don't actually need any intervention at that
Right.
point.
And a good friend will ask you, do you want me to give you advice or just like support you in what you're saying?
Well, and that's what they teach parents too, like have the same conversation with your young people. I hope there's some tech companies on here or product designers because Kristine is just dropping it with some good ideas for how we can use Gen AI and really rethink our systems and our algorithms. All right, I'm going to shift a little bit now, as much as I love this conversation. And I want to just kind of pause on some of the data that we looked around about different groups and kind of an equity perspective. So across both the segmentation and the data on who's using Gen AI, we actually saw some pretty different demographic patterns and subpopulations. So I'm just going to share a few, and then I'm going to ask my panelists to kind of respond. So one, Black youth actually stand out as the most future-oriented power user in that segment. More than 1 in 5 are actually high hope, high use skill builders. This is 4 times more likely than white youth to be using AI for learning, creativity, skill building. We also see Hispanic youth are significantly more likely to be high intensity, emotionally entangled users. So, really highlighting a need to pair AI access with strong relational mental health support. We also see, unsurprisingly, see socioeconomic differences with our data. So, youth with financial struggles are much more likely to turn to Gen AI for mental health. We also actually see LGBTQ youth using it less because of a lot of concerns around privacy and how the data is being used. So, this question for both of you, right? But we know that youth with more barriers are turning to AI because they don't have as much outside support, whether that's financial barriers, not having caregivers, not knowing where to go, having transportation challenges, et cetera. So, how should we even be thinking about AI for mental health support for young people when it is filling, a gap for some, and I'm not saying filling in a good way, right? But is filling a gap that we know exists in the system.
I'm happy to
I know
jump
that's a
in.
big
I'm sure
question. Who
Kristine
wants
has
to go
stuff to
first?
say. Who wants to go first? Yeah, I mean,
Or that's you.
I'm happy to jump in. I think there's so many equity conversations to be had about AI, and a lot of them tend to center around, who has access to it, which is really important. I mean, we're talking about the majority of systems being in English, some young people not having reliable access to internet or privacy or things like that. And I think this new research really brings up kind of even more questions. Hannah, it's interesting. The more I read this research, the less surprised I am to see that Black youth are such like high users and using in such, interesting, innovative ways. I was thinking about Kristine and I were just talking about a Pew poll that came out last year, and I was looking at it, and you know, uh, what they looked at was basically young people using AI chatbots, and around a third said they use them daily, which is pretty high. And if you look at the numbers by different groups, it's equal across gender, and then it's more likely in young people who come from higher income families and in urban and suburban areas, which we would expect with greater access. But also, there are higher rates for Black and Latino youth than for white youth. And when you look across the literature, that's not just true for chatbots. That's also true for, how much they report being online. I'm seeing Kristine nod, how much they're online, how much they're using social media. I think there's something having to do with like identity development and finding community and connecting, we're seeing across the board. And then, in terms of how we should be thinking about AI, for mental health support, knowing it's filling this gap, I think we again first have to just acknowledge that that's true and be open with young people about it. Like this is a gap right now, that services are not where they should be. And then if we accept that, we know what comes from there and what flows from there. That means we have to ensure that these systems are set up and equipped to respond appropriately because young people are coming to them, and to send them where they need to go towards caring humans. And then we also have to work on the infrastructure outside of that. What do mental health, systems look like? And then what do the systems look like for other caring adults in young people's lives?
Plus one, and I think the one thing that I'll add is that it's interesting to think around um, how none of this operates in a vacuum, right? And I think the numbers around Black youth and usage, and even how it correlates to international trends for the global South and the adoption of AI to upskill means that messaging around education, upskilling, breaking into your own has impacts into usage that then has downplays to mental health. Like this never just sits in one silo. And I think that is very clear across the variations that we're seeing in these profiles. The fact that you have some young people who are high achieving and anxiety, but they are also very skeptic. Like there's a lot there that I think is quite clear that we have worked in so many ways, and certainly funders are like this, where we have one thing that we think we want to push, and then we don't think around the like second and third order degrees. And Gen AI is certainly throwing that into a very different thinking pattern.
Yeah, yeah, absolutely. Um, so I'm gonna ask kind of a big question, and then I maybe have one or two more, and then we're gonna go to the audience. First questions. I think what's clear from this conversation, our data, right? Like AI is already embedded in youth mental health, whether we like it or not, right? It's there, and often outside of traditional care settings. If you had to advise, one stakeholder group, and you could choose, whether it's funders, schools, providers, tech companies, policymakers, or multiple, what is an important decision that you want them to be making based on kind of this data and also the experience that you're bringing?
I have a quick one. Across all groups, do not leave the young people out. in the discussion and the design and the evaluation, as I hope is clear even in this, they understand. And you're only going to get a better product. You're only going to get a better policy. You're only going to get better outcomes if you bring them into the conversation. And so I will certainly always say that is the first thing to do.
Yeah. And maybe I plus one to that and say, and bring different types of young people who are using it differently. Don't just talk to five and check the box, right, that I did it. It's really important to be purposeful and talking to lots of different young people because they have lots of different experiences, right? And they're using it in different ways. And we can only design better systems if we really incorporate those diverse voices and uses.
100%. Now I don't have to say that part. Thank you, Kristine. No, I mean, I completely agree. I think taking a little bit of a step back, really for me, I think so many of these conversations revolve around, why are young people, using these tools? How can we get them to, go to humans instead? What should we be telling parents about what to tell young people? And to me, the onus really falls on larger scale systems, on regulators, on tech companies. There need to be standards for, what is permissible. There can be absolutely no conversations about lethal means with young people, or with anyone. Absolutely should not pretend they're human. If an adult wants a system to do that, potentially yes, but with a young person, they shouldn't be pretending they're human. They shouldn't be fabricating credentials. They shouldn't be, suggesting that they, don't that they keep things from parents or caregivers. They should always be pushing users to humans, and to resources and mental health resources. And I think there are a lot of different ways you could do that. It depends on what's going on in which of the spaces, and in the policy space, potentially that's really hard right now. So maybe that looks like tech companies creating something like pharma companies did when they started to get a lot of pressure on them. They basically created a set of standards for themselves that they said, this is what we're going to operate by. And I think the other thing to say about it is that, one of the big problems is that the people who know the most about young people, that number one, that's young people. And then the other one, that's people who work with young people. And those groups are not in the conversations enough. And I've been pulled into a lot of these kind of conversations with tech companies. And what often happens is we're asked about a very specific issue with not very much context, behind NDAs. And so a lot of times there's not that much that we can help with if we don't know the larger context. So I think I'm looking at places that are doing sort of like open sourcing of safety tools, building in through APIs, like those kinds of things. Are there ways that we can make this open to everyone, especially smaller tech companies that, might not have the means to create these great systems? Can they grab them from somewhere? Kristine probably knows a lot more about this area than I do, but, so are there systems we can sort of build and put into place so that everybody who has, this kind of system can use it?
Yeah, and expanding the language, right, that we're using to identify mental health struggles, right? Like it could be perhaps that some of these tech companies are using very specific language that's not how young people are talking, right? And so the algorithms aren't flagging some of these, when a young person goes in real distress, they're not flagging because they're not using the words that the algorithms were trained on, which are tend to be like from an adult population, et cetera. So I think, kind of that and having that transparency around like, what's the language? What are the triggers? Like, what does that word look like? And is that actually the way that young people are describing things? So yeah, absolutely. Um, all right. We do have some questions in the chat. All right, let's see. So, Kristine, you spoke about AI use around young people in the global South. they're asking to share references. But also you mentioned that companion tools may discourage nearly 40% of individuals from seeking formal mental health support, which you found striking. I've seen some research suggesting that mental health outcomes have declined in the social media era, particularly potentially linked to emotional engagement and shorter lifespans. Could prioritizing mental health among young people actually disrupt the social media business model? And if so, how could platforms evolve and need to respond? Oh, that's a hard one, man.
Yeah,
Good luck.
that's a great question. Also very loaded. I will say maybe I could speak to the business side of things. I'm not sure on the if I could confidently in my lane speak to the mental health half of that questions. But I will say first, let me go back to the Global South question so I can just tick that off. I am happy to share some additional resources. Probably, I will drop them into the links because there's quite a few that I follow in terms of actually organizations on the ground that have been doing work, particularly in India, around their mental health crisis and access work. There's some work that I did early in 2020 around organizations that were doing particularly mobile health interventions in India and how Gen AI has come in to help sort of provide some bridging to the lack of use or lack of human supports there. So happy to share that later. In terms of whether or not this will evolve the social media business models, I'm gonna say no. I'm gonna say no. I think it's complicated. It is complicated. We are at a point where I think, the attention economy, the advertising, we all know it's sort of not working, but there hasn't really been a good alternative to this. My one thing I'll mention is that there is actually quite a market of solutions that are not the big five or are not the ones that you would normally hear that are intentionally built with young people, that are intentionally safe, that are deliberate about how they use LLM models. And I encourage people to do a little research. And I don't want anyone to ever feel like they're stuck with only using particularly like particularly the big ones and the ones that are general purpose, because there are quite a few out in the market, whether they're built by nonprofits or for profits, that are really useful and good alternatives to what we have available on the big ones.
Yeah, Kristine, your actually point raises another one that came up in the chat, which is that some places, right, like average waiting time for therapy, say in the UK, is a year and a half, right? And the question is like, is there a role for any AI therapy? And, is it, and, if not, or whatever, and this is like, is there a positive role for AI for young people's mental health at all? And like, what could or should that look like?
Yeah, I mean, I'm happy to jump in and talk a little bit about this. I think yes is the short answer is there is a role. I mean, all the way from development of, new medications.
Hmm.
AI has been involved in developing a number of new medications for all kinds of, issues across the board. Specific therapeutic tools that incorporate I think could be very helpful. Like today, we're talking about general purpose chatbots that weren't designed for this reason, but there are, a number in development that are being tested right now for, things like cognitive behavioral therapy, dialectical behavior therapy, these kind of more mechanized therapies where, I would say you still need, help from a real person to understand the nuances of your situation, but they could be used as adjuncts, especially while someone is waiting.
Hmm.
It sounds like the wait time is a long time in this person's situation. So yeah, absolutely. I would say that but those are tools that are designed and tested and should go through the same, regulatory mechanisms as any other, type of, medical device, for example.
Yeah. I mean, so what our data shares and what we kind of detail in the report is that when young people use generative AI technologies, and I'm kind of, again, using kind of a blanket term, as a complement to professional care, they actually can be quite beneficial, is what they're saying, right? Helping me to map out my exercise routine, journaling, thinking through how do I, meditate, what should I do? So actually implementing some of the practices that they're talking about in care, but use as a substitute, right? Instead of, that's where we're seeing young people saying, they're having bad experiences, neutral to negative, that it's not that helpful. So yeah, I think really interesting, what you're saying, Laura, about there is potentially some, but it needs to be fit purpose, designed for that purpose and tested and regulated and all that, not going to Gemini instead of, seeing someone. Kristine, any thoughts here? Anything to weigh in?
I mean, I think it's interesting because I wonder whether the kind of the gap of human care bridged with um, bridged with by AI can in fact redirect sort of that money question we were talking about earlier. I often think
Mhm.
about what are sort of the incentives that, particularly in the for-profit space, are metrics by which like people think are worth paying for, right? And in fact, like, why is it not that it got resourced to a human versus keeping them on platform, right? Like, I think sort of there are basics in sort of that mechanism that would be useful to consider in terms
Mhm.
of how to find value again with uh,
Mhm.
if we're going to work together with AI, you have to make the business side of it work, the technical side of it work,
Mhm.
side of it work. And I haven't yet heard, at least out loud, some new thinking around that. It's always been like, well, how do you keep them
No.
on the platform? And it's like,
Yeah. Yeah.
don't we actually make them, why is it not, oh, you had more people off platform because it got redirected to this human resource, right? Like I
Mhm.
think about
Yeah.
simple
How do you
choice.
think? Yeah. How do you think of AI being a bridge to care, right? Instead of an endpoint? And can it solve some of these barriers? Because, I mean, we know whether it's the US or UK, like finding professional help is hard. You've got to go, who's in your area? Do they take my insurance? Can I get there? Do they have appointment times? Like it can be quite burdensome. And so is there a mechanism for AI to play in democratizing some of that, tough path, right? That can be full of a lot of friction. As well as, but then, to get them to do that, I think there's a question of incentives, right? That you really rightly bring up. So super interesting idea. Okay, another question. Do kids know the pros and cons for using AI for mental health support, or are they taking it at face value? I can
I
tell
mean,
you
I
what the
think,
data says,
yeah,
but you.
we've both weighed in with our opinion on this. I mean, most of the young people that I meet know exactly what it's doing.
Mhm.
There's some
Same.
nuance to that. There's some nuance to that for sure. I mean, I think not everybody understands like exactly how the incentive structures work, but they understand that it's not a human being and that the purpose is to keep you talking to it.
I'll just add that I think it is proportional to digital literacy and media literacy being taught in schools. I will say I have a 7-year-old who has in her schooling has great digital literacy. So yes, she totally understands that you cannot take these things on face value, but it's because we've had the effort to teach her that, and I think that is not the case, as you all know, for a lot of, especially younger kids.
Yeah, our data is pretty clear too that most young people they know, that AI tells you what it wants to hear and is kind of trained in these algorithms. So, all right, another question, and I'm going to tie two together. Maybe I'll go to you, Laura, first. What do you think the role of trust and safety professionals is in all this? And does AI ever suggest connecting youth with 988 or crisis text line, et cetera? And if not, what are the opportunities?
Yeah, I'm happy to take both of those. Trust and safety professionals, I think honestly, it's a difficult role to be in, because it's a lot of times it's people that really do care about these issues and are advocating within a larger organization where that's not what the incentives, are pushing towards. So a lot of times when I interact with trust and safety professionals, I'm looking for them to sort of tell me what would be helpful for me to say, to the companies that they work for. Where are the barriers that they're running into? Because there are a lot of barriers when, they're making arguments and, somebody a little bit higher up is hearing, this versus this. But if we do that, then, we're going to lose money. I think that is their role, is to try to, be that intermediary that says, but this is so important this actually has to override that. Um, and then maybe, I don't know if Kristine has a comment on that before we go to the other one, because she's been in this world.
I'll just agree. I think trust and safety is in a very tough position. Anyone in sort of the product to business pipeline has a very unique translational service they need to do, which is I have very strong sympathy for, empathy towards. So.
And to take the second question on, yes, often, general purpose AI tools do point users to 988. I would say it's actually overutilized. At this point, I would say that almost all the time when you sort of do sort of test chats with general
Mhm.
purpose AI tools, they get a hint that something might be going on, and they immediately say connect to 988, connect to 988, connect to 988. It's so important. So again, it's nuanced, but I
Mhm.
do think we need to figure out more sort of like individualized, more complicated answers, where we're thinking
Mhm.
about, first prompting people to reach out to people in their lives. Then are there like communities you're connected to? Are there specific resources that might be helpful to you? Because what a lot of people are saying is that I get prompted to go to 988, and then I call 988 or text or chat, and then I'm not getting what I need. And then I'm just told to contact 988 again. And so, it's great when it works. But there's a subset of people for whom, 988 is not the answer. And so for those people, we really need more.
Yeah. I want to just kind of go back to what you were saying earlier about kind of the trust and safety people, how they're in a hard place, right? Because there's, kind of trust and safety, and then there's business objectives. Is that where, perhaps governments should come in and be able to kind of push tech companies along? Is that, what we need? Because I think you're right, like there's a lot of trust and safety folks, but if they're not the ones making the decision, then, how can we have more accountability? Laura, I'm looking at you.
I mean, yes, I think there should absolutely be regulation. I think sometimes the problem is the political environment doesn't necessarily,
Mhm.
make that possible. I think sometimes on a smaller scale, it's possible. Or
Mhm.
if there are very particular objectives that you can get a broad coalition to get behind, I would argue that there are some that exist right now that you could get a really broad coalition to get behind, like the
Mhm.
absolutely no conversations about lethal means, absolutely,
Mhm.
no chatbot should tell a person under 18 that they're human, those kinds of things.
Mhm.
But those are things that I think do need to be built into standards, to regulations that would potentially come from the government.
Yeah. Yeah, absolutely. All right, we have time for one more question, and this is a question. I'm gonna read it. I'm gonna answer a little bit, and then I'm gonna love to hear from Kristine and Gloria, which is including young people in the work and actually hearing their perspectives and not just working off examples. How can you share examples of how product leaders, nonprofits, research orgs, et cetera, can actually practically do this? So for our project, the Youth Mental Health Tracker, where we're gathering data from over 10,000 young people and really asking them questions about what it means to thrive. This is a multi-year project. We have a youth advisory board, and it's not a token advisory board. We literally meet with them every 2 weeks, and they provide input on everything that we do. Should we ask questions about Gen AI and mental health? Should we focus on politics? What should we be putting out? Is this question worded in the right way? What do you think when somebody asks you this question? And so we actually engage a group of about 10 to 15 young people for a year. We ask for your commitment. We pay them for their time, and they're deeply embedded into everything that we do. And we find that that works well because having regular channels and touch points with young people. And then we actually force accountability. So every time we meet with them, we say, here's what you told us, and here's what we're doing with it. And so that we're not just taking their feedback and say, oh, thank you, but actually here is the change that we made as a result of your input. And that really helps keep our young people engaged. But I'm curious, Laura and Kristine, how have you seen things actually work?
I have a couple of examples, and I'll just start with, if you're going to work with young people, just know from the jump that it's going to be hard. Like you're going to get you're going to get awkwardness, and I think that it should be and should be expected, right, when you're engaging with young people. Um, for us, I think one of the key points, and Hannah, you also alluded into your work, is they have to be decision makers. They have to be at the decision points of what you are doing, either as an intervention, as a product, whatever. That is decision in the design, decision in the rollout, decision in governance. One thing that we have incorporated in our own practice, beyond meeting with young people frequently and hearing the challenges they're facing, is to have them be the last stop on our funding. We present to them our top candidates, and we say, which ones would you want to actually use? And if they tell us they don't like it, which they will audibly do, we take that into consideration. And I think that is what is the farthest away from the performance of bringing young people into your work, is to make sure they actually have some decision-making authority.
I know we don't have much time, so I'll double down on that and say, my most recent example from JED is we held a convening last month on the mental health of boys and young men. And the most important thing was that everybody in that room was an expert, someone who, studied the mental health of boys and young men or was related to it in that way. And that included the young men in the room, that they were not considered sort of just like extras. They were just members of that group. And there were enough of them. I think that's really important too, that they're not so outnumbered that they feel like they can't speak. So in every one of the conversations, they were talking and you could see that they were like part of it and people were listening to what they were saying. So enough voices in the room that they're not kind of crowded out.
Yeah, 100%. I was at that convening and I thought it did an amazing job. And also, creating the space so that we're encouraging their voices as equals. So +1 to you all. Okay, I'm getting these messages like we got to wrap up. So I'm going to share a few words in closing, and then also just make sure everybody has access to the reports. So we're going to throw them in the chat again. I think, together, the reports, what we heard today is that Gen AI is not the root driver of youth mental health outcomes. It's really about the systems, right, that are supporting young people that matter the most. Young people are not a monolith in how they're using technology and how they're using Gen AI. And we need to understand that in a really substantive way so that we can design and deliver better products, solutions, et cetera, to support young people. I think from the deep dive we did on care seeking and how young people who are experiencing mental health challenges, that 12%, we really need to think about system interventions to make it easier for young people to get care. We need to think about governance of LLM solutions, solutions and systems that are not built for young people, but is where they're turning. How do we have better guardrails? Kristine talked a lot about, well, there are LLM and Gen AI solutions out there that are built with safeguards. Can we amplify some of those and get those into the hands of young people? Because we know they're using them, right? The data is very clear. And so it's really about how can we actually help them, get the best care that they can. And really, I think kind of in all of this is really kind of centering young people's voices and saying, okay, how do you want to use generative AI? What is it that you need? And how can we actually really do a better job as adults and community in supporting you all? And that includes their online world and their offline world, which, as Laura so nicely put, is all actually really together. So we thank you very much for joining us today. We will be sending out the webinar recording for anyone who's interested. We are also just kind of a quick plug on Surgo Health and the Youth Mental Health Tracker. This is one of many data reports that we're putting out. Later this year, we're going to be doing a large survey, really trying to ask the question of what is it that we need to do to help you thrive, and what are they asking for us? This is going to be a survey of 5,000 young people, nationally representative. And so we're going to also be looking at what's the differences between when we first did the survey a few years ago and today, who may be struggling more or less, how has the world evolved? Since when we did that survey the first time, their use of generative AI wasn't actually as big in the picture. So more to come on that. We'll also be going deep into a few more areas this year. So stay tuned, sign up for our newsletter, which will share all of our latest reports and information, and go check out our website, trackyouthmentalhealth.com. It has the reports. It has the typing tool, AKA the persona quiz, if you want to see which persona you are a part of, and any more information. And please don't hesitate to reach out. Thank you so much. And thank you so much to my amazing panelists. I know them both personally, and this first time we got to go on a panel together, and they're fabulous. So I really appreciate your, being here today, but also more importantly, your thought partnership, on this body of work as a whole and really helping us to drive the conversation forward. So thank you, Laura. Thank you, Kristine.
Thank you, Hannah. Thanks, everybody.
Bye.
Thanks. Bye-bye.